might have to go the Caesar route. So I'm pretty geared towards it at the moment because our baby is breech, and our doctor won't deliver a breech normally.
Even the best planned labours may not go according to plan. If medical intervention becomes necessary and you need to have, say, a forceps delivery or a caesarean section, accept that this decision has been taken with the safety of you and your baby in mind. There is no need to feel cheated. After all, a woman does not become pregnant to experience a vaginal delivery, but to give birth to a healthy baby.
I was very happy to have that I was going to have a Caesar. That didn't worry me, and it was explained to me really well in advance. So I had no fears or worries about it, but I would much rather have an epidural Caesar than a general anesthetic Caesar. I understand that at the time that was impossible because we had an emergency situation, but it would have been nice to actually be awake when my baby was born and see her immediately when she was born.
A caesarean section will be performed if the baby cannot safely be delivered vaginally. It is a major surgical operation that delivers the baby through an opening in the abdominal wall and takes between 45 minutes and an hour. A Caesar is often a planned procedure and is commonly done when a baby's head is too large to pass through the pelvis, although there are numerous other medical indications for this procedure. An emergency Caesar may be performed when complications arise or if there is little progress in labour. A spinal rather than a general anaesthetic is becoming the more common pain relief for this operation. It is safer for you and the baby, and you'll be able to see your baby the moment it is born. Don't worry about seeing or feeling anything. No doctor would dream of starting the operation if you have any sensation of pain, and from your position, you will not be able to see anything disturbing. Various types of incisions may be made with a caesarean section, bearing in mind practical as well as cosmetic factors.
We have an incision on the skin, and we have an incision on the uterus. On the skin, we can have an up and down incision or a transverse incision. I seldom use the up and down incision on the skin. On the uterus, the only incision used nowadays, or virtually the only incision, is the transverse incision. The up and down incision being reserved for very extremely small, very small, less than 1 kilogram babies.
If you prepare yourself for the possibility of having a caesarean section and understand why it may be performed, there is no reason why the birth of your baby should not be a positive experience.
I was going for an active birth and I started to be quite distressed and ill, and the midwife persuaded me to try the jacuzzi for the pain relief, which I did, and it was absolutely wonderful.
Some women choose to give birth in an active birth unit, which incorporates the philosophy of Dr. Frederick Leboyer and his belief that a baby is just as sensitive to noise, light, movement and pain as an adult, and should therefore be brought into the world in a gentle and calm environment, with low light and a minimal amount of disturbance. Although a gentle birth focuses more on the experience of the child, a mother who chooses this method will often be actively involved in the birth and will choose to have as little medical intervention as possible. She will probably keep pain relief medications to a minimum and rely instead on massage, correct breathing techniques, relaxation, warm baths, and the strong support from her partner and the midwife. At the moment of birth, she will be fully aware of what is happening and will actively assist in pushing her baby out. The midwife usually carries out this type of delivery rather than an obstetrician, but the obstetrician will be close by if any problems do arise. Remember, whatever form your baby's birth takes, the most crucial factor is a safe delivery and a happy and healthy child.
He looked quite strange, obviously, because they are bluish in colour. They look like little frogs when you're born, so thin and scrawny, and not as podgy and round and bouncy as you would expect your baby to be.
most parents regard their newborn babies as uniquely beautiful, they may not exactly resemble the dimpled angels their parents had expected. In fact, they may display all kinds of peculiar color changes, spots, blotches, and secretions. These are the result of the baby's physical immaturity as well as the birth process itself, and may take up to 2 weeks to disappear. The head may be lopsided or elongated due to pressure during birth. There are also 2 soft spots, called fontanelles, where the skull bones have not yet fused. In addition, your baby's face may appear to be quite unsculpted, puffy cheeks, small chin, flat nose. Another frequent source of surprise is the prominence of the baby's genitals. These conditions are quite normal and should pass harmlessly as the baby grows.
One of the most important examinations that one can undergo in one's life is examination in the newborn period. About 33% of all conditions which a person suffers from later in life are diagnosable either in the womb or in the immediate neonatal period. Problems, if diagnosed in the newborn period, can be immediately corrected. One can set about correcting them, and the damage that subsequently occurs to the baby is then minimal.
As soon as the baby is born, its condition will be assessed according to the universally accepted test, the Apgar scale.
5 tests that are looked at initially, immediately, at 1 minute, and again at 5 minutes are the following. First of all, one has a look to see that the baby has a heart rate. Then one has a look at the respiratory rate to see that the baby is actively breathing, and this is looked at whether it is regular, whether the baby is breathing at all for that matter, or whether the baby has an irregular, jerky sort of breathing rate. Then one has a look at the tone of the baby. You can see that this baby is lying with good tone, holding his arms up, and he's moving around quite actively. When a baby is asphyxiated and not breathing at all, the baby may be very flaccid and may not respond in any way at all. The fourth situation that one has a look at is at reflexes. And when I talk about reflexes, I mean, is the baby grimacing? If one stimulates the baby, is the baby coughing, crying, etc.? And that is also given a score. The final test is to look at the color of the baby. If the baby is asphyxiated and not breathing at all, the baby will be blue, and we call this particular sign cyanosis. That means that there is a lot of carbon dioxide in the blood. If you breathe normally, there would be a lot of oxygen in the blood, and all of us are pink or red.
One question that always pops up is, Doctor, is my child normal? Is he going to be normal? Is he normal? Is everything all right? Well, you can actually tell them that there are several very, very important and pertinent observations that are present from about 24 hours onwards that will tell you whether the child is normal or not. And these are the neonatal reflexes of the baby. The first important reflex is the grasp reflex. You will notice that when I put my thumb into this baby's palm, it clutches my thumb like it's doing here, and it holds tight. A retarded baby does not do that. When I lift baby, it will cry, but its head control is good. That head is coming up very, very nicely, and it's holding that head. The retarded baby will flop back. It's not doing that.
The next thing I'd like to do is to do what we call the primitive stepping reflex. Where the baby will step, and look as if the baby can step forward. And then the last reflex that I would do in the delivery room would be to look at what we call the moral starter reflex. The baby is held with his head flexed or bent up like that, and then when I release the baby will throw its arms out in a startle way.
The most vital test that is done is to recognize the significance of newborn jaundice. Jaundice is pointed to a whole host and multitude of abnormalities that can occur at present and subsequently in that baby's life, not least of which is an abnormality of the thyroid gland.
Okay, babies can cry in the night because she's got jaundice. The reason for this is often because the babies have just got a bit of an immature liver. And the reason why we put them under the lights is just so that it breaks down the bilirubin in their system. So what we do is try and keep them as exposed as possible. So when we put them under the lights, we just put them on a napkin, take all their clothes off, and we just wrap a bandage around their eyes because a lot of exposure to the ultraviolet lights can cause damage to the cornea.
Your baby is born with a number of abilities, some of which are reflexes. He can see, hear, suck, swallow, smell, taste, yawn, sneeze, cough, cry, and sleep. Within a few days of birth, he can recognize you by your smell, and soon after that by sight. At the same time, he must cope with a bombardment of new stimuli. There is light and darkness, warmth and coolness, movements and restrictions, sounds and smells and tastes. All in all, there is a lot of learning for both of you. Your baby needs to be handled in such a way that his new life seems as little different as possible from the womb. His needs are simple, and they need to be met, simply and immediately. Wrap him warmly, hold him closely, and handle him slowly. Feed him when he is hungry, and talk to him when he looks at you. Unless he is actually ill and under medical care, there is no need to do anything to him if it makes him jump or cry. If you can manage this, the baby will gradually become a settled, lovable, small person. And that, after all, is the best possible start that you can give him. The birth of your baby is the climax to long months of waiting, yet it can also be an intensely emotional and confusing time. You are still desperately tired, your hormone balance is disturbed, and your body is striving for equilibrium. These changes may cause you to become tearful, irritable, and depressed. Fortunately, this depression usually lasts for no longer than a week. Take one day at a time and don't try to accomplish too much in these first days. While not physically affected, your partner also has an emotional tightrope to walk. He too is deeply involved and has to decide how to divide his attention between you and the baby. Keep in mind that paternal bonding is just as important as maternal bonding, and that extended contact between father and baby should be encouraged. Very often, birth helps a man to enjoy emotions that he might otherwise find difficult to express. The postnatal period is a time of adjustment during which your body gradually returns to its normal non-pregnant state. Immediately after the delivery, your uterus will rapidly begin to decrease in size. These contractions are called after pains and will normally disappear after 3 to 4 days. For anything up to 6 weeks after birth, you may pass lochia, which is the vaginal loss that follows delivery. For the first 3 to 4 days, this is red and may contain some tiny clots. It then turns dark brown and gradually fades to a cream color before disappearing. At this time, you should not use a tampon, since your womb is not yet fully healed. Use only comfortable sanitary towels until you have had your 6-week postnatal checkup. The use of tampons may generally be resumed after this period. You may experience discomfort in the perineum, especially if you have had stitches or your baby was quite big. Ask your doctor for a suitable painkiller and try to begin your pelvic floor exercising as soon as possible. A short relaxing soak in a warm salt bath is very soothing, and you may find it more comfortable to sit on an inflatable rubber ring. If you had a cesarean section, you will need some form of pain relief, and may also need help with feeding and changing your baby. A midwife or physiotherapist could show you the most comfortable way to get in and out of bed, and how to support your wound if you need to cough, sneeze, or laugh. Foot and leg exercises should be commenced as soon as possible. The length and type of hospital stay can vary greatly. It is advisable to investigate your options well ahead of time. Some hospitals offer rooming in, which allows a newborn to remain in the same room as his mother for the entire stay. This is especially recommended if you wish to breastfeed. Other hospitals favor a modified version, whereby the baby stays with the mother during the day and is taken to a nursery at night. The option of full-time nursery care is also usually available. Apart from doctor's rounds and meal times, babies must be fed and cared for, and the mother's condition must be monitored. You may also have exercises to do, thank you notes to write, and friends and family to greet. All in all, your hospital stay may turn into a hectic and exhausting time. However, nothing is more important now than to restore your energy and well-being. You will need to be physically and psychologically strong if you are going to meet your baby's needs adequately in the weeks and months ahead. Before being discharged, a doctor will examine you to see that your uterus is returning to normal, and that your stitches, if any, are healing and breasts are normal.
All these little people, whatever they're subsequently going to be in life and whatever they're going to turn out to be, are all basically the same.
Finally, the moment arrives when you can take your precious bundle home. Your baby will be dressed in his own clothes for the first time, and you will be in non-maternity clothes at last, although you may still look 4 months pregnant.
In the hospital, it was still a pleasure, you know. The nurses bring them to you every 4 or 5 hours, and you feed them, and then you take them back to them, and then you go back to sleep again, and they bring you tea, and they bring you coffee, and they bring you food, and you come home, and it's a huge shock. You don't know what to do with them, you don't know how to handle them, when they cry, you don't know what you're supposed to do. You're clueless, nobody prepares you for it.
As you enter your front door, you are likely to experience a mixture of feelings: elation, but also a great deal of anxiety. Cradled in your arms is a totally helpless little being who is all-powerful in his claims on you. But you can prepare yourself in advance to cope with all these stresses by reordering your priorities so that the well-being of mother and child top the list. Decide what's important and try not to worry about the rest. Take all the help you can get and simplify household routines. Go for convenience goods to save energy, your most precious resource at this stage. Lastly, make time to relax. At least once a day, take a break from the house and go strolling outdoors with the baby. As your little one grows, your priorities will constantly change to keep pace with his development. You will become more competent at the complex job of parenting. You will probably be surprised at how quickly the unsettled newborn has evolved into a person with tastes, preferences, and characteristics all of his own. Since your newborn seems quite vulnerable, you may be scared of holding her, but the sensation of being tightly enclosed gives a great sense of security. Hold your baby firmly and always handle her gently, slowly, and as quietly as you possibly can. Never shake your baby or handle her roughly. Until she's about 4 weeks old, your baby's neck muscles will not be strong enough to support her head. Always provide the necessary support when holding her or picking her up or putting her down. If you are picking up your baby, slide your one hand under your baby's neck to support the head. Slide your other hand underneath your baby's back and bottom to support the lower half securely. When holding your baby, support her head in the crook of your arm or hold her against the upper part of your chest with her head resting on your shoulder. When laying down your baby, again make sure that her head and bottom are supported until she has time to register the security of the mattress. Many babies dislike being dressed and undressed, but nevertheless need to be changed frequently in the first weeks of life. You will probably be a little awkward at first, but don't get flustered if she cries. It's a good idea to dress your baby on a flat surface so that both your hands are free to deal with the clothes. Choose clothes that are easy to put on. Anything that opens down the front or that has a wide neck opening is preferable, as babies hate having anything put over their heads. Avoid clothes with ribbon fastenings and strings. These can become wrapped around the baby's neck.
I only ever use terry nappies on both my children, unless I go on holiday, then I'll use the disposable.
Since the average baby eventually has more than 4,000 nappy changes, it makes sense to carefully weigh up the available choices. You'll have to decide whether to buy cloth or disposable nappies, or both. Cloth nappies are initially more expensive to buy, but can be cheaper in the long run. Their main disadvantage is that they have to be washed, sterilized, rinsed, and properly dried after every use. This can be a laborious process, and you may even find that a tumble dryer is essential. You will also require extra equipment, such as nappy buckets, sterilizing chemicals, and pure soap washing powder. Another factor to consider is the cost of plastic pants and nappy liners. Disposable nappies have the advantage of convenience. They are also easier to put on since there is no folding, nappy pins, or plastic pants, and generally they fit better since they're available in different sizes. Nappies with super absorbent gel have the advantage of drawing wetness away from your baby, keeping her drier and helping to prevent nappy rash. However, the cost factor needs to be carefully considered. Most parents find that a combination of cloth nappies and disposables suit them best. While fabric nappies are fine for home use, disposables are useful for outings and holidays. In general, a baby's nappy should be changed when it is wet and as soon as it is soiled to avoid nappy rash. This could be as many as 12 times a day in the early weeks, but on average 7 to 8 times a day from 3 months onwards. It's a good idea to establish a permanent nappy changing corner where you can have all the supplies on hand. Before undressing the baby, make sure that everything you'll need is close by. If you're using a toweling nappy, remember the nappies can be folded in different ways. The kite method is probably the easiest and most widely used. However, there are other methods, one with heavy padding in front, particularly suitable for little boys. After folding the nappy, put a nappy liner in place. Remove the soiled nappy and wipe the baby's bottom with cotton wool dampened in warm water or baby lotion or oil. Girls must always be wiped from front to back to prevent germs from entering the vagina or bladder. Dry the area thoroughly but gently, then lift the baby's legs and slide the nappy underneath. Apply a barrier cream, then bring the nappy up between the baby's legs and fasten securely. Finally, put plastic pants on over a toweling nappy and dress your baby again.
It was a little bit nerve-wracking to begin with, but you get into it quite quickly.
Although bathing is not essential in the first few weeks, your baby is likely to feel fresher after it. If you don't want to bath your baby, or if your baby seems frightened and distressed, you can top and tail him by washing his face, neck and bottom. As the weeks pass and your baby's pleasure develops, bathing can take place every day.
Okay, put your cold water in first and then your hot water. You test the temperature of the water with the inside of your arm or your elbow, an area that's sensitive to temperature. Okay, your hands are not sensitive to temperature because you're using medication with hot and cold all the time. You can start off by washing your baby's head. Okay, you just take the towel and you want to wrap your baby's arms nice and firmly so that they don't interfere with what you're doing. Just wet your hair nicely. And just take a very little bit of shampoo. Okay, you do not need a lot of shampoo to wash the hair. Very important to just make sure that you leave all the soap residue off your baby's hair. And just wet your baby. Oh, nice. And then you just take the soap and you soak your hands really nicely. That's a good job. And you just start off by soaking you around your chin and down your waist. Yes. Then down in the creases of the legs. Pull your baby over slightly. Okay, and soaping your back and your bottom. Just rinse the soap off your hands because babies are slippery. Soapy babies are very slippery. Okay, and then you pick up your baby. When you pick up your baby, okay, the head resting nicely on your wrist, underneath the baby's arm. A nice firm grip when you've got your baby there, because when you put your baby in the bath, that's the only grip you're going to actually be holding your baby back. So it's important that from the beginning you have it nicely. The other hand, okay, underneath its bottom and around its leg. Okay, and then you can move the baby very nicely, really, into the back. Okay, at this stage you can take some soap and wash their hands and rinse it straight away. And there's no chance of it going to their face. Then you can take the baby out and you wrap the baby nicely in the towel. Okay, and then you just pick your baby up. Okay, and basically then you line over. Yes. And then just pick up your baby and you can rub it while you dry it.
The baby sleeping patterns were quite erratic at the beginning, and in fact they still are. She's got her days and her nights mixed up. She's an angel during the day and a monster at night.
Newborn babies spend 2/3 of a 24-hour day asleep, drifting randomly in and out of sleep. But gradually they settle into a regular pattern of wakefulness and sleep. After a few weeks they become more aware that night differs from day. Keep in mind that babies vary in their sleep requirements just as adults do. While some are active and wakeful, others will still be sleeping through much of the day at 4 to 5 months of age. Both patterns are normal. For the first month or two, when your baby still needs night feeds, you will probably prefer him to sleep in your bedroom. But you may also want him to sleep in a separate room right from the beginning. As long as it's warm and free of drafts and you can hear him when he cries, your baby can sleep practically anywhere. The safest sleeping position for a baby seems to be on his side. Some parents prefer to wrap up their baby in a sheet or blanket before putting him down. No baby should ever have pillows under their heads, as this is unnecessary and can be very dangerous. Babies who wake frequently at night are exhausting for their parents, but this is inevitable during the first few weeks. When your baby wakes in the night, it is best to deal with her needs immediately, but as briefly as possible. Quite a number of babies wake and want the reassurance of being held by mum or dad. Talk to him for a while, but do not be tempted to indulge in prolonged playing or cuddling sessions. Once he learns that he will be fed or comforted as needed, but is unlikely to get extra bonuses, he should start to modify his behavior.
I breastfeed for about 7 months, and it's actually much easier. You can breastfeed anywhere. While you're shopping, you just stop it when you're changing unicorns, or so it's much easier. You don't have to worry about bringing bottles up and making sure that the formulas are right.
I prefer breastfeeding, okay? It's really easy. Get up in the middle of the night, there's no bottle warming, there's absolutely nothing. All you have to do is clean yourself and feed the baby.
You feel more closely bonded physically and emotionally to a baby. She stayed with me at work for about 4 months, during which time I breastfed her, which is quite interesting because we don't have a closed door policy in our office. None of the offices have got doors. Everybody walks in and out as they please. So we got into some interesting situations when I was breastfeeding Chloe and people walked into my office. But it was okay because I just turned my chair around and saw the chairs and leaned back and carried on feeding my baby.
The value of breastfeeding is emphasized every year by professionals who rediscover the benefits of breastfeeding to both infants and mothers.
Certainly, if it works, breast is best. The major advantages, as far as the relationship between mom and baby during that time, you can get no closer than that with mom and baby. It gives them time together. The antibody properties of breast milk certainly do protect the child, especially in those first 3 months, in that the baby cannot produce any antibodies of its own until the 3-month stage, and will get that from the mom, and so be protected in that way. The fact that the breast milk is the right temperature, the right nutrients are there, there's nothing that is likely to upset the baby. Certainly it can occur, but in most instances, breast milk is absolutely perfect for the baby.
Every woman is naturally equipped to feed her baby. Human milk is by definition precisely formulated to fulfill the needs of human babies and provides all the nourishment that a baby needs for the first 4 to 6 months. But breastfeeding is more than just feeding your baby. It is a time of physical closeness, love and warmth which promotes an intimate bond between mother and child. Once established, breastfeeding can be the most relaxing and pleasurable activity for both parties. Women who breastfeed also find that their wombs contract more quickly after birth and that they lose weight more easily. However, getting started with breastfeeding often needs some guidance. Many first-time mothers find the first few days worrying and strange. But with a little patience and the will to succeed, breastfeeding can be established with a minimum of fuss in most cases.
You are very big and very hungry. I'm going to show you what to lecture you in 2 of the basic positions if you just open for me. The first position being the football position. The main idea that when you latch the baby, you take as much of the areola as possible, and then you can bring this arm all the way around for me so that you can do like that. With this hand, cut your breast for me, 4 fingers underneath, and move your finger below the areola. That's beautiful. Okay. Eyes open now.
It is important that you are comfortable during feeds and able to relax completely. Sit propped up in a bed or on a good supporting chair with arms. Hold your baby high enough so that he can reach your nipple without effort. Cradle his head in the upper part of your forearm and support his back and bottom with your lower arm and hand.
Over the body arm. It's absolutely beautiful. And you can see that he's sucking, that he needs his whole jaw. Okay, then you know that he's left and that he's actually sucking. There you go. That's beautiful. No, don't cry. That's my boy.
The key to successful breastfeeding is putting the baby to the breast correctly. If your baby takes only your nipple into his mouth, he will get no milk and his attempts are likely to make your nipples sore. Make sure that your baby has the whole nipple in his mouth and that his gums are firmly gripping the areola, the dark area that surrounds the nipple. Make sure that your breast does not obstruct his nostrils. The amount of time you have the baby on each side is entirely up to you and your baby. If he feeds from the first side for 8 to 10 minutes, that breast should be emptied. But babies often remain at the breast for much longer than they need to for strictly nutritional purposes. They simply enjoy it and take pleasure from being close to the mother. If he has finished feeding on the first side, gently remove him from your breast. Don't pull against his suction, as this will hurt your nipple. Break the suction by slipping your forefinger down between the areola and his lips. If he doesn't want the other side, simply offer it to him at the next feed. In this way, both breasts will be emptied and stimulated equally in 24 hours. It is not necessary to wash your breasts with soap and water after every feed. Just wash them normally during your daily bath or shower and dry them well afterwards. To help keep your nipples supple and prevent cracking, you may find it useful to apply a special cream after each feed. Be sure to wear a good supporting bra which does not flatten the nipples. Nursing pads are convenient since they absorb any milk which may leak and help keep the nipples dry. Although breastfeeding is a rewarding and deeply satisfying experience, a number of problems can occur. Fortunately, most of these can either be prevented or easily treated. Again, the correct information and adequate support are vital. In this regard, the La Leche League can offer invaluable assistance.
Hello Janet, my name's Karen and I'm from the Leche League. I just want to give you this book, which is our manual that we recommend at all new mothers read. It's full of nice information about breastfeeding. I'm just going to talk to you for a couple of moments about things to expect when you get home. You might find when you get home that for the first night all the baby does is cry, and you might feel a bit nervous about it. It's just a change of environment. The baby's been used to the hospital. Don't worry about it, just feed your baby on demand when he wants to feed. Try and cut down visitors and rest. Don't try and do too much. Just concentrate on your baby. The baby will go through these periods. That's at 10 days, it's at 6 weeks. Then you'll have to feed more often. This isn't that your milk's gone away, it's that the baby's going through a growth spurt and just wants to build a piece of milk supply. All you do for a couple of days is just feed your baby nice and frequently so that it builds his supply back up again. You just listen to your baby for a couple of days. And you'll find once your milk supply's built back up again, he'll go back to his normal routine. One more thing to watch out for is blood ducts. You might find a tender spot, sometimes under the arms. It might be a tight bra, it might be that your baby's gone a long time in between the feed. All you need to do is massage the sore spot, put your baby to the breast, let the baby drink. Blood ducts aren't a problem as long as you get rid of them quickly. If you find that you've got a temperature where you feel that you've got flu, then go and see your doctor for an antibiotic, as this can be the beginning of mastitis. You want to control it before it gets too bad.
Remember, with the correct help, information and support, most difficulties can be overcome.